leading the way. On air, online, and on the go. WLWT News 5 Today starts now.
All right, thanks, George. Well, don't let your winter workout routine put you on the sideline. Coming up, Beacon Orthopedics Dr. Glen McClung, there he is here to help you prevent injury.
This year, the winter weather is sticking around in the tri-state a little longer than some of us hoped, and that means more people are keeping their workouts inside. But working out on heavy machines can lead to injury. Joining us this morning is Dr. Glen McClung from Beacon Orthopedics, and he wants to talk about specifically about using a treadmill, and especially people are still using treadmills at this time of the year. So,
absolutely.
What about the treadmill can be dangerous, or is it dangerous, I guess?
Well, there can be dangers with using the treadmill. The biggest one is overuse injuries. So the big thing you have to watch out is the amount and the rate of intensity that you're going. So, for example, many patients will get on the treadmill. The biggest thing they do is they don't warm up. Okay, that's the #1 thing you have to do. They don't get those muscles warm. And a lot of them will stretch for like 2 or 3 seconds and then go on the treadmill and, you know, hit it all the way up to running and take off.
Right.
And then with that, you know, the big thing is patients will get these overuse injuries. Overuse injuries, the biggest thing is they're watching the TV, they're listening to the music, they're watching the numbers, and next thing you know, they start having foot pain or they start having knee pain, and it's like, well, you know, they stop and they try to stretch it out and then go back on it. And what we see a lot of patients get are stress fractures. So the biggest thing that we can tell patients is, look, when you're before you work out, obviously the biggest thing is warming up. You have to stretch your muscles, and a lot of times it's dynamic stretching. You know, it's not just sitting there and doing a static stretch, but doing a lunge with a squat. And using your upper body as well when you're trying to stretch, which are several different stretches that you can do. The other thing that they have to do is they have to really monitor how far they're going. So, you know, the thing we try to tell patients is no more than increase your length of run 10% a week. You know, so if you're going to go, you know, you don't want to go more, you know, you don't want to go 2 miles and the next week go 3 miles or 4 miles. And then the other thing is really pay attention to what you're doing. I can't tell you how many patients I've seen that have been on a treadmill and miss a step, you know, fall,
or jump to the side,
and fall, dislocate their shoulder, or split their head open. So these are, you know, injuries we see that happen on treadmills.
Now, for specific like stress injuries that you mentioned, how are you treating those?
So
that's a problem.
So the big thing is we'll have several patients come in that'll have pain in the foot or the knee or ankle, and once we diagnose that they have an actual stress injury, i.e. stress fracture, at that point in time you really have to shut them down from the run. You know, you can put them on other things like a cycling machine, and then we try to get them into physical therapy and strengthen the muscles around that. And many times that's the problem. They may have a weak quads or weak hamstrings, and they go and they start running 4 or 5 miles, and then that's kind of what's led to their injury as well. So it's just not all onus on the treadmill. It's partly the patient's condition as well. And so we get them into therapy and we try to get their muscles around their knee and their hips strong.
All right, well, thank you so much for coming in this morning. And I know a lot of people are still going to be out and about on those treadmills the next couple of days, so they've been warned. Jonathan, let's send it back to you.
Fair enough. All right, thanks, Jennifer. Still a lot more ahead.